Good morning, everybody. Today I wanted to talk about a nutrient, so a little nutrient in the spotlight, and it's iron. And it's one that I commonly see low in patients that I'm dealing with, especially women. So iron, I think we've all heard about iron deficiency being anemic. What are your iron levels? If you're feeling tired, is your iron low, etc. So iron plays a big role in our red blood cells. So it's the building blocks of this part of our red blood cells called hemoglobin. Basically, it's imperative for hemoglobin, which is therefore imperative in the makeup of red blood cells. And red blood cells, among many other things, and hemoglobin, a massive thing that they do is help transport oxygen around our body to all of our cells. And then when our cells take up the oxygen, they release carbon dioxide, and again, those red blood cells help take out the carbon dioxide and we breathe it out through our lungs. So super important for survival, right? Oxygen. So it is something that I commonly see deficient people are low in, especially women, because we get our periods every month. Hopefully we get our periods monthly. So we're bleeding once a month and we're losing iron that way. So if a patient walks in common signs or symptoms of low iron, whether it's anemia, which is extreme low iron, or kind of on the spectrum of iron deficiency, and it's a big range. You could be subclinical, so you could be technically within range, but you still have low iron. So it's quite a spectrum of iron deficiency, and I want your iron thriving. So some signs and symptoms of low iron can be fatigue, weakness, tiredness, things that you could normally do are currently making you tired, shortness of breath, because we know iron plays a huge role in oxygen being carried around the body, excess yawning, because your body's trying to take in more oxygen because it's struggling, pale skin, dizziness, lightheadedness. A big one for me is restless leg syndrome. So restless legs, especially at nighttime. So it's that feeling, I get it, I do struggle with iron, the uptake of iron. It's that feeling where you have to move your legs or get your fabulous partner to massage your legs because they're just really jittery and restless. That's a big one for low iron. So if I suspect a patient might have low iron, it's super easy to check. We check it in your blood test. Your GP can do it. It's a really basic test as part of a full blood count. Ideally, we can get a full iron studies as part of the blood test, so that shows me all other aspects of your iron as well. So a full iron studies tells me exactly what's going on with your iron. And then the beauty is that we can correct it. So there's definitely foods that are high in iron. Number one is our red meat. That's the most absorbable form. And we have chicken, we've got fish, we've got eggs, beans, nuts and seeds, green leafy veggies. So there are foods that are high in iron. But if someone's got quite low iron or anemia, iron deficiency, we do need to correct that in the form of a supplementation, basically. And why can someone be low in iron? Can just be that they've got low iron in their diet, in what they're eating every day, especially if they're vegetarian or vegan. Could be if they're female, so they have periods, or if they have really heavy periods. Pregnancy increases our need for iron. So we can see our iron levels dropping in pregnancy, so that's something to maintain there. If we've got a compromised gut, so if our gut is off in some way, we're not able to absorb all the beautiful nutrients that we need, including iron sometimes. And iron relies on other nutrients as well, particularly B12, vitamin C, other B vitamins, vitamin A. So if we're kind of low in other vitamins, especially B12, that can affect our absorption of iron. And there's other factors that play a role in iron absorption as well. So that's a really basic rundown of iron, but if any of those signs or symptoms, or you might be vegan or whatever, or you might know that you may have low B12, anything, if you feel like you actually might be low in iron, hit me up. I'm super happy to chat. You may need to get tested, maybe not. It's something I commonly see in clinic, and something that is quite easily tested and easily corrected, which is awesome. Cool. That is it from me. Have a glorious day.